The first time I saw her with Claire, when I was pregnant with Claire, I didn't really know what I was supposed to do. So I called and said, I'm pregnant. I need to, for my first appointment or whatever. And they said that I could see Jeannie. And I guess my first, I didn't know, about a nurse practitioner or who she was, or this was before I had even met her. And so my concern was, well, okay, is that enough? Like, I don't need to see a doctor? And they said, no, she can, see you for your initial, and then I saw her. I didn't have any complications, and I saw her right through. I don't really remember the first appointment, but it was good. The official or unofficial policy is for your first time pregnancy, first time, you have to go somewhere else because they don't have a delivery room here. Basically 2 weeks before I was due, I was supposed to be going to Saskatchewan, Prince Albert, or somewhere else, and we don't have family down there, so you're expected to stay in a hotel or find your own accommodations, and it's not covered by, I have Blue Cross, it's not covered by them. So that was my big concern, my whole pregnancy. That was my biggest stress, that I was going to have to be shipped out somewhere and find, hotel room for 2 weeks. I like Jeannie personally, and I liked the fact that I could see her and it was consistent care. I didn't have to, every time, sometimes here, especially here, you get to see whatever doctor you happen to get into. And with her, she knew my history, she had it, so I didn't have to repeat everything every single time, which I find frustrating when you go in and you have so long of an appointment and they ask, back from the beginning. Sometimes you have to wait a few weeks to get in to see the clinic. But Jeannie herself, when you call the clinic line, you get press 1 for the receptionist, press 2 for the nurse practitioner, and you can leave a message, which I've done with Jeannie, and she's always called me back. I had concerns, and she addressed them over the phone and, said if it happens again, she should come in and things like that. So that is really nice. I make use quite often of the 1-800, the telehealth line. But it's nice at the same time to talk to somebody here and have that consistency of, well, I already talked to her about this, I can make an appointment with Jeannie, and anything I've raised with her, she's always followed up on, or, further research. If I had a question that she wasn't completely familiar with, she'd get back to me, and I have full confidence in her as I would a doctor. So I see Jeannie as often. When she's available, that's my first preference. I think nurse practitioners are wonderful. Jeannie's the only one I've seen, but her role, I think, is really important in the community.